Hello, I'm Hannah Bollich. I am presenting on behalf of the Hotspotters program. We did a poster for community-based intervention models effect on empathy. So emergency departments often function as a canary in the coal mine, exposing the areas of healthcare systems that are most lacking in safety nets. Hotspotters programs have historically sought to address patients with exceptional utilization of emergency services. The New Orleans program pairs students with such patients with the goal of identifying and accessing appropriate medical services, as well as promoting health literacy. While there have been many studies on various Hotspotters programs and their efficacy for patient outcomes and emergency department utilization, to date, there's limited data for the effect on the students participating in the program. The aim of this study is to examine changes in students' perceptions secondary to participation in community-based interventional models. So for our design, we have healthcare students enrolled in New Orleans Hotspotters programs are going to be asked to complete the medical students S version and health profession students HPS version of the Jefferson Scale of Empathy prior to enrollment, and once again after completion of the program. The Jefferson Scale of Empathy was developed to measure empathy in physicians and other health professionals involved in patient care in a clinical setting, as well as students studying medicine and other forms of healthcare in preparation for working in a clinical setting. Cross-sectional data for the academic year 2022-23 will be compared and analyzed to determine changes in empathy among healthcare students as a result of participation in a community-based interventional model. For our results, we expect to see increases in students' empathy as measured by the Jefferson Scale of Empathy for patients enrolled in the Hotspotters program, as well as development of positive perception of those relationships. So while the major focus of study involving Hotspotters programs has been in outcomes for patients enrolled, important data on the effect of these programs for healthcare students is missing in the literature. A greater emphasis on community-based interventional models would be supported by data displaying growing empathy for future providers from participation in such programs. So again, I'm Hannah Bollich. I'm representing Hotspotters, and we would accept and appreciate any feedback or suggestions for our study design. Our contact information is at the bottom of the poster, and thanks for listening.